we took was to insist upon personal responsibility. Now let me tell you for just a moment about why it is that we decided to go ahead and put in place our plan. First of all, I'll note that about 94% of our population in my state was insured before we put this plan in place. For that 94%, there was no change in their insurance policies. The program remained the same. So we're dealing with that last 6% that weren't insured. But that last 6% sounds like a small percentage, only 6%. But that's 500,000 people. I don't know how many people in this room have lived without health insurance. But I have not only family members, but dear friends who have lived for one time or another without health insurance. It is a frightening experience. You wonder what happens if I get ill, or more seriously, what happens if my child gets ill. I had 500,000 people who I was elected to serve who were frightened because they didn't have insurance. As a result of the plan we put in place, about 400,000 of them are now insured. And I'm pleased with the fact that we were able to accomplish that. The other people who have insurance, the 94%, there's another feature for them. They don't have to worry about losing insurance if they change jobs or develop a serious condition and then change jobs. Because under our plan, everybody in the state is able to get affordable insurance. I also note there's no government insurance here. We didn't create a government insurance program or a government policy that people got. No, we gave people a premium support program where they could buy their own private insurance of their choice, and for the poor, we helped them with support. The analysis of what the cost of the program would be was carried out by a group called the Massachusetts Taxpayers Foundation. They're an independent think tank funded largely by business interests. They looked at the Massachusetts healthcare system after reform, and they concluded this, that the cost of the system is relatively modest, and that it costs less than 1% per year of the state budget. Now that's not free by any means, but it's not what some people might have thought. Some people might think, oh, did this thing cost half your state budget? A quarter of your state budget? 10% of your state budget? No, it costs less than 1% of the state budget. And by the way, I think that's too much. If I were governor, I'd get it down to 0. Because don't forget, we were already paying for people who were getting free care. I wanted to limit how much we were going to pay in the future to that amount that we had already been paying. All these things we did without a tax increase. Now I know that with that summary about what we did and its differences with President Obama's plan, that explanation is not going to satisfy everybody. And I respect the views of those who think that we took the wrong course and who think we should have taken a different course. I also recognize that a lot of pundits around the nation are saying that I should just stand up and say this whole thing was a mistake, that it was just a boneheaded idea, and I should just admit it. It was a mistake and walk away from it. And I presume that a lot of folks would conclude that if I did that, that'd be good for me politically. But there's only one problem with that. It wouldn't be honest. I, in fact, did what I believed was right for the people of my state. And I'm going to describe for you now what I think would be right for the people of the United States, which is quite a different plan. Now, I'm going to turn to repeal and replace. And go back to the question again, why repeal? I told you some of the things I didn't like about the President's plan. Let me give you some more. And I'm going to start with just an overview again of our healthcare system. And I know we have doctors and professionals in the medical community here, so you'd probably elaborate on this, but just a couple of thoughts. There's some major advantages of our healthcare system relative to those in other nations in the world. I believe we have the highest quality healthcare in the world. We provide to our consumers an extraordinary level of choice and freedom. We attract to the profession the best and brightest from among our population, and we're the most innovative place in the world for medical technologies and drugs and instruments and devices and so forth. We do, however, have some disadvantages in our system. It is a high-cost system. It does not have, by and large, portable insurance. People are worried that they might lose their insurance if they change jobs. We have about 50 million people that don't have coverage. And when I say tax discrimination, what I'm referring to there is that individuals that want to buy insurance on their own are treated differently under our tax code than people working for a big company where the company buys the insurance for them. That's tax discrimination. Now, unfortunately, the president's plan, at least in my view, detracts from some of the best things in the American healthcare system. It hurts the quality of healthcare by having healthcare more dominated by government. It also reduces consumer choice by having government play a bigger role in deciding what insurance you can get and what will be covered under your insurance. It repels the best and brightest. Now, I know there's some doctors in the room, and so I'm not going to ask for witnesses here, but my son went into medical school, and he talked to a number, there are no Romney doctors in my immediate family, so he talked to a number of people who were doctors and said, what do you think about going into medicine? And almost without exception, they said, don't do it. Unless you really, really love it. My goodness, this is a tough profession to go into because of what's happening by virtue of government's heavy hand in medicine. There's no question in my view, but the president's plan will tend to repel people from coming into the medical profession. And finally, I'm afraid that the Obama reforms discourage innovation. Heck, when you tax people who are developing devices and instruments that are used in medicine, they're going to have less funds to invest and create new innovation. But there's more wrong with the president's plan. I believe it's an economic nightmare. It does not lower health care costs overall in our system. It raises taxes, it diverts Medicare funds, and it kills jobs. Let me tell you, as I go around the country and talk to business people, and I was one for 25 years, when you explain and when they understand the implications of the Obamacare program on them, they're less likely to hire people. They're concerned about the cost of Obamacare on their ability to hire and train workers. It kills jobs. It is, in my opinion, one of the reasons why this recession has taken so long to get out of, and why we have 20 million Americans unemployed, underemployed, or have ceased looking for work. There are more things I don't like. I don't like the massive federal spending. I don't like the power grab from the states. I don't like the massive federal bureaucracy. The Republican Joint Congressional Committee tried to chart out how Obamacare works. Prepare yourself. This is their slide. That is not a pretty picture. And suggest to me why it is that people are a little concerned about getting into the healthcare profession. So for all those reasons, if I were lucky enough to be in the White House in the position of leadership, on the first day I would issue an executive order paving the way for Obamacare waivers to be given to all 50 states. And then I'd go to work with Congress to make sure that we could repeal Obamacare. But now let's look at what I do instead. You won't be surprised here, because what I'm going to describe to you is basically the same structure that I described 4 years ago when I was running for president. I should note, by the way, that was a time when my Massachusetts health care plan was considered, at least by me, to be an asset politically. I hear some laughter in the room. That's not the case now. But you will note that despite the fact it's gone from being seen as an asset to being seen as a liability politically, that the plan I'm going to describe for you is the same. I'm not adjusting the plan to reflect the sentiment, the political sentiment. The plan, in fact, starts with the same elements. And let me begin with what I consider the objectives of my plan. One is do no harm. Two, strengthen the current healthcare system by lowering costs and improving quality. By providing portability, that's the ability to know that you're going to keep your insurance if you change jobs. Improve consumer choice. And then expand health care by dealing with those individuals who have pre-existing conditions fairly, and provide greater access to care for those that are low income or uninsured. 5 principles. Restore states to leadership, empower individuals to purchase their own insurance, focus our federal regulation as opposed to making it overbroad and over-bureaucratic, reform our medical liability system, and introduce market forces to health care to the extent possible, one by one. Restore to the states the responsibility and the resources to care for their own poor, their own uninsured, and their chronically ill. The state is the best place to determine who's